Hello, hi. Hello, hi everyone. Thanks for joining us. We're just starting. Hello, hi. Okay, so Dr. Amee will be with us in just a minute. Hi everyone. Has anyone joined this session for the first time? Any first time viewers? Welcome. So we're just waiting for Dr. Amee to join the call and then we'll be good to start.
Hello, Rashmi.
Hi Dr. Amee. How are you doing?
I'm
Good to
good.
see you. All well, all well. Everything's great. Super excited about today's session. Dr. Ami, your voice is breaking just a bit. Is there anything you can do to adjust?
Um, okay, let's do a quick check. Okay, you ask me a question, so then you can see if it's
Yeah,
working.
I think it's a little better. In between, it's a little choppy, but we'll go ahead and we'll see if we need to fix that.
Okay.
Okay, thank you everyone for joining us. A very warm welcome to all of you to our third session of Know and Glow with Dr. Amee. Today, of course, we all know it is the occasion of Mother's Day. Mother's Day is tomorrow, and we really wanted to do something special for all the moms out there. So today's session is on skincare for mothers and really mothers, who are experiencing motherhood across, all stages, whether you are a pregnant mother or you're a new mom or you have older kids. We really hope that this session has something special that you can take away from it and learn from it, and of course no better person to help us with that information and that with those tips than Dr. Amee. Dr. Amee, welcome again. So excited to have you here, and I think this is a topic that both of us have spoken about earlier, and we really want to do a nice informational session for all the moms out there. You're a mom yourself, so what better person to have?
Super. I'm also very excited, Rashmil, because this is very personal to me, and I have so many patients who go through so much of ups and downs, not knowing what to choose. So,
Yeah,
I really thank Health and Glow to get this session so quickly in your, Instagram list that we can help everyone, who are in this stage. And yeah, it's a wonderful thing. And please, I invite everyone to ask as many questions as you want, because then we know exactly how to guide you. So feel free,
absolutely.
even to stop me in the middle and ask me all your questions today. We have 1 hour, so make full use of it.
Yeah, I think last time we had so much to share that we actually extended the session by 10 minutes.
Exactly.
And I think we do have a lot to cover today. So just for everyone who's just joined in, we're talking about skincare for moms today. We're going to be talking about what factors affect skin for mothers. We will talk about how and what your skin goes through various stages of motherhood, and hopefully share some really valuable insights and tips for all the moms out there, because we know you live a busy lifestyle. There are so many changes happening in your life, around your life, and it's if we look at just skincare as one aspect, it's a very small thing, but I think really we need to look at motherhood in totality, and what mothers go through. And, that's really what we want to highlight in the best way possible today. So yeah, let's get started. I think just before we get into, the first introduction to the session, I just want to remind everyone that, like Dr. Amee said, please ask a lot of questions. We really hope that, moms who are joining this session, please share your skincare doubts, your concerns, anything that we can help you with. You can use the question widget below on the screen to send in your questions. We'll also be giving a little surprise to the person who asks the best question this session or helps us with the best interaction. So there's a little surprise in the end, which obviously Dr. Amee and I will decide at the end of the session, and we'll let you know on our page. By Monday, we'll be announcing who that person is going to be. So yeah, a little extra exciting element to today's session. So let's get into it. I think, Dr. Amee, the first thing that we wanted to really talk about is what are the factors that affect skin for moms, or through those various stages of motherhood. We all assume that obviously when you're pregnant, a lot of people say your skin is glowing, and then you have a baby, and then you have no time, and then from there it's really about getting older. And we all know that skin will age. We all know that skin also evolves with time. But really, what are those factors apart from pregnancy, hormone changes, and even for mothers, after they have their child? What really happens, and what does the skin really go through?
Yeah, so you've asked me like a gamete of questions.
I
So
know.
I will take it, in parts. So first thing that a woman faces, especially after she gets married, is most of us a change of place, a lot of change in our food habits, because what we were used to eating earlier, it changes because we've traveled or we've moved, and it's another house, another family. So these are the first few things, along with a little stress on ourselves, that the first thing a woman undergoes. So, when you get married and when you move or change places, it's very important that you look at your skincare routine while you're even looking at, changing the way you dress up. So, you've moved from, say, south up north, and it's winter. So, you're going to get those jackets in Chennai or something. You never use that. So along with the wardrobe change that you're going to have, it's very important to have a skincare change too. Basis the environment that you're living in, and also considering that your skin is going to go through a lot of changes because of the stress and the new thing that is involved, in the whole process. But remember to keep skincare very simple, especially in transition times. I keep telling my patients that whenever there's a transition, suppose you're moving from home to a hostel, or you're moving to a PG, or you're moving cities, keep skincare very simple. Do not have to carry, or don't, use some 10, 15 products, because you don't know what's working, what's not working for you. So in transition, always keep it to 3 basics. One is your face wash. Second is your moisturizer. And third is your sunscreen. Now, this moisturizer can be used morning and night. So, we typically choose moisturizers like that. So whenever in transition, you need only 3 products. And then once your skin starts getting used to that particular change is when you add. So that is the first thing I want everyone to understand. And pregnancy, again, is a transition. It's just a transition internally. It's not externally, it's not visible, but there are a lot of changes, like all of us know, from within. So you need to keep your skincare very basic, very simple, especially in the first trimester. So, I'm sure people have this question in mind that, I don't want to use chemicals on my face. So, in my pregnancy, I'm not going to use any chemicals or any products, and we run and find organic and herbal. And, we're in this lookout for everything that is, that's non-toxic. But I want everyone to understand that water is also a chemical, and we drink quite a bit of it, and we're told every time that you keep drinking. So it's not chemicals that are faulty. It's just that that should suit or that should go with pregnancy. That is the important thing. So today, I hope there are pregnant women here listening to this, because I think it'll really solve your confusion as to what products to use, especially in your first trimester. I want you to use a cleanser or a face wash which does not have any exfoliants like an AHA or a BHA. The face wash should be as simple as it can get. So maybe just aloe vera gel or glycerine based face washes that do not have any other actives, not even tea tree oil for the time being in the first trimester. Along with that, a moisturizer. Again, the moisturizer can be as simple as possible. It could be just aloe gel with glycerine with, say, squalane in it. That is it. Just the basic moisturizer, and on top of that, a sunscreen. I just want everyone again to remember that sunscreens, I have repeated in this earlier session. So if you really want to know the thesis on sunscreens, please go back and check. But the sunscreen that you choose in the first trimester has to be physical sunscreen. Now, what do I mean by physical sunscreen is sunscreens that contain only zinc and titanium dioxide. So these two are physical occluders. Now, the difference between a physical and a chemical, just to make it very simple, the chemical sunscreen tends to absorb the light, from the sun and the ultraviolet, convert it to heat on the skin. Whereas a physical sunscreen is just like an umbrella. The light falls and it is just thrown back. Similarly, a zinc or a titanium dioxide on your face will just throw back the light without absorption. So a physical sunscreen is what is recommended, especially in the first trimester. Now, during this time, I'm sure you will notice a lot of change. Like some women, their skin just glows. It just looks so beautiful. And some, just are tackling with acne throughout on their face, throughout those 9 months, which generally clears up after they deliver, But for those acne too, it is always better to meet your dermatologist and not use over-the-counter creams for acne, because they contain 3 very important ingredients that we completely avoid during pregnancy. One of them is retinol, or vitamin A, in its various forms. So retinoic acid, retinol palmitate, retinols, tretinoin, all these are avoided completely during pregnancy. The second, Rashmil, which everyone needs to understand, is salicylic acid or beta hydroxy acid. Most of our cleansers, face washes, anti-acne creams have salicylic acid in them. They are to be avoided as much as possible in your pregnancy, and especially in the first trimester. So that's the second thing.
Right.
And the third is a hydroquinone. Hydroquinone is an agent which is used for lightening. It lightens the skin, it lightens the scars, but it cannot be used in pregnancy. So these are the 3 things, very essential to check all the products that you pick up, turn around and just check the actives. And any of these present, you should avoid it completely. So, that is one thing for the face, very important during pregnancy. Post-pregnancy, again, because we're lactating, we avoid these medications until we stop lactation, which should ideally be 20 to 24 months. So that is about 2 years post-delivery. We should avoid these. And post that, of course, depending on how your skin is responding and how many changes have happened in your skin, we can always start using our medications later. So, I'm seeing a lot of questions coming. So,
Yes. I just want to remind everyone, I think Dr. Amee spoke about this. This is our 3rd session. And so our last 2 sessions were on, for the first one was on where to begin skincare, and the second was one was on summer skincare and travel skincare. And I think we've covered the topic of SPF quite extensively, and sunscreen rather quite extensively in those sessions. So anyone who does want to go deeper into understanding this, do refer to or do go back to Health and Glow and check out the last few sessions that we've done. So yeah, there are a lot of questions coming in, Dr. Amee, and I think I think some of them we are covering as part of the session. Some of them we will definitely talk about. I think one of the important things that you mentioned was retinol, and that kind of stayed with me because retinol is such a trending ingredient right now. And obviously, we are saying that, women, once they reach the age of 30 or past 30, should start using retinol because, that's when aging really catches up. But it's so important for women to know that it's an ingredient you should avoid during pregnancy because I'm sure a lot of women do have that as part of their skincare routine.
Absolutely. So the minute you start planning conception,
Yeah.
we omit all these medications and we add folic acid to be taken orally. So
Yes.
if you any doctor, you need to begin with folic acid orally, a 5 milligram, but you need to stop your retinols, your BHAs, even AHAs if you can, as well as your hydroquinones and your lightening creams. These are a complete no-no. So don't even wait till you get, or you get a positive urine test. The minute you're planning pregnancy, do stop your retinols at night.
Right.
Very
Yeah.
important. And there are great alternatives to retinol. So it's not that, okay, you might just get pregnant after 2 years, maybe, after a year, after a couple of months. It's not that you have to stop your skincare regime. There are natural retinols which are present in the market. We have very nice moisturizing hyaluronic acid itself can be used throughout pregnancy. So it's not that you have to, let go of your skincare routine or get your skin worse if you stop retinol. You have good alternatives available, which can be used throughout pregnancy. We just need to make the change.
Right. I think one of the questions that a lot of people have, and some of the questions that we're getting in right now as well, are with respect to skin concerns during pregnancy. I think that is definitely, like you said, a huge transition, for a to-be mom to make and their body to make, really. So obviously, we know of some of the more commonly spoken about skin conditions, right? Like stretch marks. That's something that, and we know because there's so many products that talk about stretch marks. But then there are a lot of other skin concerns as well that happen during and, post pregnancy, really, like, hyperpigmentation, melasma. Someone has put in a question asking what to do about melasma. There is post pregnancy. What I have read in the research that I did is that your skin tends to get very dry as well. There are parts of your body where skin's very sensitive. So can we maybe deep dive a little bit more on that?
Sure. So, see, when we get pregnant, right, one very important change that happens in our body is the growth hormone starts increasing because we're growing the baby in the body. So, the growth hormone increases. So, everything stretches, everything
Yeah.
grows. So, like your abdomen girth grows, everywhere else it grows, right? So, this growth hormone is good in certain aspects, as in your hair. When growth hormone increases, your hair becomes luscious, you have no hair fall, and it's beautiful and shiny. But in certain places, it doesn't work well, like, acne. There are many people, because of the growth hormone, can get acne. And of course, there are other changes too in our female hormones, that is the estrogen and progesterone. That's when you start getting the mask of pregnancy, or it's called the melasma. Now, one thing that we women have to, I think, accept more than remember is that once, we get pregnant, there are two things that you just cannot avoid. One, if you've started getting melasma, you cannot treat it, and your stretch marks. It's like a
Yeah.
sign of pregnancy that you cannot get rid, or you cannot even treat it. The only thing one can do is try and prevent. Now, in prevention, I really want to tell everyone who's not yet, gone through the rigors of pregnancy, is that the minute you conceive, the minute you get a positive UPT, you really need to start working on your skin and body, especially abdominal care, up to the knees.
Right.
Because when you get stretch marks, your thighs also, because everything expands because of the growth hormone. So even your thighs and all those areas start getting stretch marks. How can we prevent stretch marks? The only way we can reduce the intensity is by improving the blood supply. So if we massage oils regularly on our the abdomen and the lower thighs, we're improving the blood supply coming to that area. It will prevent stretch marks. But again, by saying prevention, it's not that it will completely prevent not a single stretch mark. The only thing you will notice is probably that it's less in number than it normally would be if you don't. The other
Yeah.
thing here important is that, in these areas, there'll be a lot of sweating, because the size increases and these are all occluded areas. These areas tend to get infected. Many a times you see fungal infection, you see bacterial infection. So keeping these areas clean, absolutely moisturized. Use of a moisturizer is extremely essential here, and loose clothing. That is the next thing, very important in pregnancy. Sometimes we want to hide it, especially in the first trimester. So we wear those tight fitting clothes so that, we don't look a little more bulky. But it's
Yeah.
important to let the air come in because we prevent infection there. Melasma can be prevented by two ways. One, don't forget your sunscreen, because of the hormonal changes, right? There are a lot of areas which in our skin get sensitive to the ultraviolet light. Now, if we prevent the ultraviolet light directly hitting the skin, the pigmentation tends to reduce. So that's when you can reduce the effect of melasma and, of course, stretch marks, but they can't be completely prevented. For dry skin, there are two tips that I want to give everyone. One, always take an oil bath daily. I know it's a little cumbersome, but when you massage oil all over the body before you're showered, you're improving the blood supply, plus you're reducing the dryness. Secondly, when you take a shower, the water directly doesn't hit the skin because there's a layer of oil there. Immediately after shower, put on your moisturizer before you put your clothes. That'll be, the end of dryness. You will never notice dryness during pregnancy. So this is what you can do to prevent.
Right. Um, I hope that's answered some of your questions. In case you do have any more questions, please do, put them in the question box below. We have another question, which is how to get rid of black spots.
Right. So black spots are not just noticed on the face. During pregnancy, we see it even in other body areas, and this again is because of hormonal changes. Now, why do we get pigmentation? Most of us don't understand is that pigmentation is because of friction. So if you see your elbows, your knees, sometimes your back, especially for IT guys who are constantly sitting, they get very pigmented. It's because of friction. So at any given place, if the friction increases, like if you're wearing tights or you're wearing a belt every day, that spot is going to leave a black spot, especially in pregnancy because our hormonal changes happen. So whenever you notice black spots on your body, first figure out if there is any friction in that area and avoid friction if possible. The second thing on your face is your sunscreen, because all our pigmentations, especially during pregnancy, are ultraviolet induced. The hormones tend to make your skin more sensitive to ultraviolet light. So if you protect it, it's going to help. If you're going to go out during the afternoon, especially between 11 and 3, carry an umbrella too, despite using a sunscreen, because it gives you that added physical protection and reduces chances of getting black spots. If black spots still are present and they are irritating you, niacinamide and azelaic acid, these are the two anti-pigmentation creams which are quite safe during pregnancy. So pick up products that contain these. It's safe to use for the black marks or spots during pregnancy too.
Right. So I think so far we've covered, what ingredients to avoid and what kind of a skincare routine to have, especially when you're pregnant, right? And how you can sort of tackle some of the common skin conditions that do come up during pregnancy, like stretch marks or melasma, what you can do to prepare for it as well. Because, like you said, that's also very important for moms who are still planning to have a child. It's important that they strengthen those parts and start paying more attention to those parts of their body and their skin as well. Now, obviously, once you conceive, when you have your baby, there's a lot of change there as well, of course. And it's not just your body changes, but it's really lifestyle changes, right? Because every mom I know, and I know because my sister's a new mom, right? And, this has come up so much in conversation. But it's like really you forget yourself. You have your full attention is now on this baby that you've had, and really everything for yourself kind of goes out of the window. But obviously you're, like you said, you're lactating, you're feeding your child, you're breastfeeding your child as well. There are still a lot of changes. And I think this is something that people don't generally talk about, which is why also it was so important for us to do this session. Breastfeeding is not easy. There is a lot of change that your body goes through with just breastfeeding as well. And then having to take care of, your baby full time. I think for a lot of moms who used to even follow like a very simple skincare routine before they had a baby, it kind of just it just disappears because you're not doing anything to take care of yourself. And there are two aspects to this, from some of the research that I was doing to understand, is that one aspect is to be able to take care of yourself and your skin, but at the same time, it is also about your baby's health. And I've also been reading about, what people refer to as kangaroo care or skin to skin contact, because your baby is constantly in contact with you as well and your skin. So I think one aspect is, how can busy moms really do, still invest some time in their skincare? What can that time be? How important is it for them to do that, right? And then also, again, a lot of things that my sister was, asking me, which is, what ingredients can I put on my face? A lot of moms don't realize, because their baby is touching them all the time. And so it has to be safe for the baby as well.
Correct. No, that's absolutely true, and especially the first time moms, who just have their first baby. I still remember, I have when patients come to me with hand dermatitis, first thing I ask them is, how old is your baby and is it the first one? Because the
Yeah.
paranoia is associated with the first child. You constantly either are washing or sanitizing your hands. So yeah, I totally understand. I'm a mother too, and I face the same problem, especially when my first child was born, is that the whole, everything turned upside down. You sleep during the day and you're awake at night, and you don't know when you eat, you don't know what you're eating. You're just fed by, elders, because you just have to feed the baby. That's all. You feel like a cow, at that stage, and I understand. But, now with so much of scientific research and so much of understanding of lactation, and a mom, a new mom, where postpartum depression in the first 1 year is extremely common, it's very
Yeah.
important that we spend those 5 minutes on us to just make us feel good. It's not about looking good, it's about
Yeah.
feeling good. I feel the minute you touch your face with a little more, concern or understanding of what it needs, you heal yourself mostly. It's not that just applying a cream in the morning that is important. It's the way you apply the cream, the way you appreciate it, the way you feel your skin, the way you understand your skin is very important. I understand the baby is the most important criteria at that time, but I do urge all mothers who are listening to this, coming from a mom with two children, is that you need to keep some time for yourself, so that you can give the right amount of attention to your baby. If you are frustrated, if you're angry, if you're not sleeping well, you can't translate that love to the child. So always remember to take those 2 minutes off. And I tell moms, it's a very simple thing. When you go to brush your teeth, splash cold water on your face. There are three things that you can use even if your baby touches you and puts the finger in the mouth. The first is hyaluronic acid, second is aloe vera gel, and the third is a face oil. It could be anything. It could be rose hip, it could be pakuchi, it could be squalan, it could be argan oil, any of these. So you choose out of the three what suits you. So the minute you brush, you splash cold water, dab it dry, put your oil, put your sunscreen, and you're out. It doesn't even take 2 minutes. It's just 60 seconds. You're good to go till the afternoon, where you repeat the same process. Just after lunch, when you have that 1 minute to spare, apply cold water, put your aloe gel, hyaluronic or oil, and your sunscreen. That's it till night. At night, just after dinner, again, when you go to wash your face, is when you use your night serum. Now, these night serums, as I said, should avoid retinols and BHAs. But now you can look at azelaic acid, you can look at niacinamide, you can look at facial oils which have a little bit of essential oils in them, because lavender, citrus tends to give you that cool, calming effect. So you can pick up those oils which you can use at night, and they are again very safe for the baby. Even if you sleep next to the baby, it's fine. Pick up from brands which are well known and the clinical trials have been done, so that you know exactly that you're using the right thing. So if you look at the whole thing, Rashmil, you don't even need 5 minutes. It's 2 to 1. That's all. And you can keep your skin feeling good, looking good, and you feeling more confident. So this is just the
Yeah.
basics for all mothers who have infants or toddlers and they have no time for skincare. This is more than enough. The sunscreens, because these are physical sunscreens, they are tinted. So it gives you the foundation effect. So you don't even need to use a compact or a BB cream, because this gives you the foundation effect. So it's just great to go. I really want all of you to try it, and please give us feedback as to how you felt, the young moms, how you felt after using this, and did it really save time and did it make you feel good? Please do write to us.
Yeah, I really hope that moms do try this out. And I think, like you said, more than anything, it's really about feeling good. I think most moms, after they give birth, like you said, they just feel like they're home all the time, cooped up in a
Yeah,
room trying to take care of a baby.
yeah,
And really, they don't feel good about how they look because they've just gone through this, ordeal of pregnancy and things like that. But it
absolutely.
is so important for them to do that little bit, for them to actually feel good about themselves. That's
Yeah.
so important. And because postpartum depression, like you said, is just so common these days.
Yeah.
So yes,
Beyond.
it may not solve it, but it really, I think, will help in making them uplift themselves and feel better.
Totally. And just beyond this, I want to put in a word that, your clean skin or good skin is also a feature of what you eat, how much you sleep. So it's clean
Right.
skin. I tell my patients it's an inside job. It's not just an outside job. So a very happy gut, a healthy gut and a happy, clean mind is very important. So what you eat, how you eat, the amount of water you drink, and the sleep that you get. And here I don't mean by sleep all night. It could be just in bits and pieces. When your baby sleeps, see to it that you go to sleep. So these things also add on to giving that natural, healthy glow, on the skin. So a happy gut and a happy mind is very important.
Yeah, yeah. Those are such important tips. We have a couple of questions here. Someone has asked, how do you manage dry, flaky skin? And I think this is also like a post-pregnancy thing.
Oh.
So how does one deal with that?
So dry, flaky skin, if it's just, just a little simple dryness of the skin, very simple. Remember to do an oil bath. Apply oil before shower. Post that, put a moisturizer. Now, in the moisturizer, I want you to look for two things. One is something like a glycerine, hyaluronic acid, aloe vera gel, propylene glycol, because all these are good humectants. They absorb water and they keep it on the surface of the skin. And the second that I want you all to check is any form of oil. It could be a shea butter, a mango butter, it could be argan oil, it could be macadamia oil, any of these oils as the oil then acts as a layer that prevents evaporation of the water. So these two ingredients are extremely critical when we look for a moisturizer, especially post-pregnancy. But if the dryness is much more and the scaling and flaking is associated with redness, then we need to use anti-inflammatory creams. So I would always advise them to meet a dermatologist, because then we need to assess, is it eczema, is it psoriasis, or are we dealing with excess xerosis? But try and do this, an oil bath followed by a moisturizer containing a humectant and an occlusive. That should do the job for you. Try to avoid taking bath or showers with very hot water, because that causes more evaporation of the oil or water from the skin. So take a shower with cool, as cool as you can tolerate water, and that should help you.
Yeah. Another interesting question, and I think this is something that's maybe relatable to a lot of moms. It says, "Hi, since sleep is so elusive, what can we do to reduce our dark circles or puffy eyes?"
Yeah, perfect. Very important question. And thank you so much for reminding us. had almost forgotten it. So two tricks that really worked for me, and I'm telling you from my personal experience, is that whenever you have time, just keep green tea bags with you. So when those tea bags are there, whenever you have the time, just spray rose water. You don't even need to go and wet them. Just spray rose water and put it around the eye. It's not just the eyeball, but it's also below the eye. Now, what this does is polyphenols or catechins, which are present in the green tea, tend to absorb the excess bags or excess water that is collected there. So it will reduce those bags. Secondly, they're antioxidants, though they will prevent pigmentation. And third, most important, is they'll improve the blood supply under the eye. And that really helps reduce the dark circles. So green tea is one. The second that really works, and I had said that earlier also, is just 2 spoons in the refrigerator, 2 stainless steel spoons kept in the fridge or the freezer, and you just apply it on your eyes. Keep it for about 10 to 15 seconds and remove it. That's going to reduce your pigmentation as well as your puffiness. So rather than trying those expensive creams, especially at this stage where we don't want to put in retinol and other ingredients, home care is the best way to take care of this. And this will really work.
Right. Yeah, I think a really important question. We have a couple of people, I think, who've just joined in the session, and they've probably missed our discussion on melasma and pigmentation, because there are a couple of, maybe 2 or 3 people who've asked a similar question. So maybe we can do a quick recap for them on the melasma point that we spoke about, or the pigmentation.
Yeah, so melasma is basically called mask of pregnancy, and it's always due to hormonal changes. And unfortunately, because it's hormonal and it's genetically mediated, so if you know that your mom or your sister, your aunt has had it, there are very good chances that you will get it. Now, melasma can be prevented and can be controlled, but we cannot cure it because, as I said, it's hormonal. Now, prevention for all pregnant women, very important to use a sunscreen even if they're at home, and to reapply it twice. Pick up physical sunscreens that contain zinc oxide and titanium dioxide, because they do not have any chemicals that can cause any other issues or sensitivity. So use your physical sunscreen morning and afternoon during lunchtime. That is one. The second is post-pregnancy. It's good to use lightening creams, and niacinamide, azelaic acid, natural lightening creams like resveratrol. These are extremely safe during pregnancy and lactation. So if you've noticed that, please do apply that at night so that it can reduce the effect of melasma. Post-lactation, we can start much stronger creams, that is with retinol, with hydroquinone, with kojic acid. That will again reduce the melasma, but we can only control it. Any other kind of pigmentation, which is generally not so much hormonal, it could be frictional, it could be because of trauma, it could be stretch marks. So stretch marks initially, Rashmi, you've never been pregnant, so you don't know.
Yes.
The initial stretch marks are always dark, especially in us Asians, they are that purple red color. And when they are purple and red in color is when we can actually, reduce its effect or manifestation. When they become white in color is then very difficult to treat them. So, when they are that fresh red, purple in color, we always advise good massage with good oils, sesame oil, argan oil, olive oil, sunflower oil. These are beautiful. They improve the blood supply and they cause stretch marks to lessen. So, if a stretch mark has so much of a gap, it then narrows. So that's about what we can do. We can't completely remove that, but it reduces. So that is one. The second is even vitamin E. Vitamin E is a wonderful antioxidant which massaged in that area will help. The other natural ingredient is Centella asiatica. It's a wonderful ingredient. It is used a lot in Chinese medicine, which is safe again during pregnancy, which you can use to reduce those stretch marks. So there are good creams that are available now containing that. But again, it's never going to be, completely cured. We can only reduce its manifestation. So that's about stretch marks.
Right. So I think just to give a quick recap, we've covered, pre-pregnancy, during pregnancy, what one can do for, certain skin conditions. Of course, I think for all the busy moms out there, it is possible to have a very simple skincare routine and still be able to take out those 2 minutes for yourself. So like, Dr. Amee said, please do try out these tips, and we would love to hear back from you. Please write to Health and Glow or to Think Skin Clinic. We would love to know what you guys felt about these tips, if they were helpful, if you have any more questions, or if there's any concern that you're experiencing. We would love to know about that. Please do share in your questions. I just want to remind everyone who's just joined the session that we have a little surprise to give away to the person who asks the most interesting question. So please do send in questions, and that'll help us improve the interaction and make it more valuable for all of you. Okay. I think since we have covered the initial stages of pregnancy, and I think post that it's just like, okay, yeah, now it's normal, now it's just aging. Are there any other things that the skin goes through, say maybe 2 or 3 years and beyond post pregnancy?
So, one thing that we've noticed is that, start getting a lot of freckles in lentigines. And we start seeing something which is very common in Asians. It's called DPNs. They are these black marks which are raised. So if you know, Rashmila, a freckle is flat, right? I mean, you can't, when you touch it,
Yeah,
you can't
it's
feel it.
on
But
the skin. Yeah.
it's just on the skin. But there are some which are stuck out. And when you actually
Yeah.
touch them, you feel them protruding. These are called DPNs, and you also see them on the neck. This again happens because our hormones are changing. The growth hormone has, it put excessive growth in the skin. So you start noticing these things. Now, these things, it's good news. Unlike a freckle where you can't completely treat it, these can be removed in a dermatologist clinic. So DPNs and skin tags, if we notice, especially you see around a year post-pregnancy, is when you can get them removed and they do not come back in that same area. So that is one good news that we see in 1 year post-pregnancy, women getting it. The second thing that you can start doing after a year or 2 years after you stop lactation is that you can start using your retinol based products. Now, because in these 2 years, the child has taken so much energy out of you. And of course, we've aged, So, there are going to be those fine lines, wrinkles, a little bit of uneven skin tone that you notice. And this is the right time to get back to your skincare routine, which we made very
Right.
simple because we didn't have enough time at that time and didn't want to be pressurized with, a whole lot of ingredients in front of us. Now's the time that you can make a difference to your skin. And the first thing that we add here is the retinol. Because retinol is known to stimulate collagen. We all know retinol is so good and all, but here at this stage is very important because this can also help prevention. So
Right.
retinol not only treats those lines and wrinkles, but also prevents aging. So the minute you stop breastfeeding, adding a retinol to your night routine becomes very critical. The second thing that you need to add is an antioxidant. So it could be vitamin C, vitamin E. If you're herbal, you can get your green tea based products. There is one more called resveratrol, which is, derived from grapes. It's a wonderful antioxidant. So these containing creams, because those free radicals tend to create havoc on the skin. So, if you've not been using it earlier, you should add it to your skincare routine. So this is the time when you really need to work probably with a dermatologist to plan the right treatment for you. A good cleanser, a good moisturizer, which also has antioxidant properties, a sunscreen, and a night cream, which has retinol along with a antioxidant. This is the time you can get back to your makeup too. Because we avoid a lot of lipsticks and those kind of things. We just prefer to put a liner if at all, not even
Yeah.
much because the child is constantly touching, and as you said, skin to skin contact is so important at this time. So we avoid those things, but now is the time that you can get back to that because the baby is a year or 2 year old. Start with makeup which is mineral based makeup, not those liquids, because mineral or powder based makeup is very safe even for children. So, when you're
Yeah.
getting back to your routine and starting all your stuff, pick up mineral based products. Always check the expiry date. Generally, it's not written, so you have to check the manufacturing date and keep a 12 months to 18 months in your mind and discard it if it is beyond 18 months. Because I remember I had this favorite lipstick, and then when I, wanted to wear it, and I'm like, oh my God, it's almost 3 years since I've bought it.
Yeah, that's
Realize
true. That's true.
busy with the child that you don't even realize, and you don't have the heart to throw the lipstick, which is so important, and so you love it, and you might not get the shade back, and so but
Yeah,
always
true.
check the expiry date when you're getting back to your makeup routine, and please chuck all that is 18 months and before. You should not use them. So that's another thing that women need to remember.
Okay, so Dr. Amee, I think we can do something a little different. We have someone who's requesting to join our session and perhaps to ask a question.
But
So I'm going to accept the request and we'll see if we can ask a live question on the.
yes, do that.
Yep. Okay, so there are some questions which are relevant here. Hello, hi there.
Hi, hello. My name is Sanjana.
Anjana.
Hi, Dr. Amee. Hi, Rashmal. First of all, I've been following this session for really like the past two series, and it has been really helpful. So thank you so much.
Thank you.
And
Made my
so my question was, so my cousin sister recently became a mom. I think it's been 2 months. So she's someone who has had like really clear, glowing skin all her life. And even during pregnancy, she had that pregnancy glow. Now, all of a sudden, she is experiencing postpartum acne and dry skin. And that has really taken a hit on her self-confidence because she doesn't really come out as much. So she wanted to know that, if it's something that is reversible or if it is something that is just permanent. And if acne is just going to be a part of her life now, essentially, yeah.
This is so much postpartum understanding. We women suddenly start feeling that. But
Yeah.
just tell your cousin it's so temporary. It's just because of those hormonal changes, the skin has,
Yeah.
kind of misbehaved. So there's nothing to worry. And this is the time where she first needs to check her skin type. So very important to know
Got it.
dryness plus she has acne. So, to
Got it.
her skin type and know what she's doing. So, she can go on to the Health and Glow app and figure out her skin type and then probably decide what is right for her. Now, here she just needs to do 3 simple things, please tell her. One is
Hmm.
use a cleanser which is neutral, so something
Okay.
like aloe gel, or glycerine or rose water or cucumber, absolutely neutral face wash. So that will reduce the dryness. Okay, because it's absolutely. The second thing is ask her to pick up a physical sunscreen with which is a lotion form. So you get, in Cipla, I can only tell you medicated ones. In Cipla,
Correct.
something called Revela Tint, which is a lotion. So she can use that. That will take care of the dryness as well as the marks that follow after acne. Okay. And
Got it.
she should use just a basic moisturizer. She can use fresh glycerine or fresh aloe vera gel. That, and on
Okay.
acne, she should put salicylic, she should put azelaic acid. Avoid salicylic.
Got it.
You get a 10 and a 15% azelaic acid gel. Ask her to use that. It's just a matter of 6 months and everything will clear out. But tell her to keep her
Okay.
spirits high, because when you're applying all this, keep it in mind that it's going to heal. If you keep that in mind,
Got it.
faster.
Got it. Thank
Yeah.
you so much. I'm sure this is very insightful.
Yeah,
I'll let
please
her know.
Thank you.
know.
Thank
If
you.
really, and if there's anything else you need.
Thank you so much.
You're
Thank you,
welcome.
Anjana. Hope this helps.
Thank you. Yes, thank you.
Okay, that was nice. That was exciting. We
Yeah.
have one more person who's asked a question again, pregnancy related. Akshata. She wanted to know again what are the products that are suitable to use because your baby is constantly on you and touching you. So I think you mentioned hyaluronic acid is something you can start using. Aloe
Yeah.
gel. Maybe a quick recap of those ingredients or products.
Yeah. So these are all edible products, and if you can get natural ones, it's great. So, fresh aloe gel will help. Hyaluronic acid, especially from good brands, and look for hyaluronic, which is plain. Do not take with retinol, with vitamin C, with niacinamide. Just get plain, pure hyaluronic acid. Whenever you use these humectants like aloe gel, hyaluronic, or glycerine, always use it on wet skin. They tend to get absorbed and they tend to spread better. So that is the first thing you can do. So even if your baby touches, there will be hardly anything that comes on his or her hand. So that is the first thing. Second, what you can use is facial oils. All these oils are absolutely edible. Your vegetable oil. So your coconut oil, sunflower, safflower, sesame, olive, all these oils again are absolutely safe to use. And on top of that, don't forget your sunscreen. Again, zinc and titanium dioxide are edible. Even if they go into the baby's tummies, nothing happens. So these are the things that you can use. Avoid your retinols, your BHAs, and your hydroquinone. Very important.
Right. So we're getting another request to join the live, Mannat. Mannat, it would really help if you can send your question in the question box first, and we will be able to invite you to join the live. Okay. There is another question here, which is an interesting question as well. Just going to find it, just a minute. Yes. So there's someone here who said that their mom is 46, 46 years old. Is it too late for her to start using retinol, and what would you recommend for her skin?
Oh no, there is. I mean, to tell you very frankly, I've never used retinol Rushmill, and I am 48. So it's just a myth that you have to. But yes, especially if you've not taken enough care during your early years. See,
Right.
skincare just doesn't degrade overnight. It's a cumulative effect of so many years, of not taking enough care, which is why
Right.
we start using a sunscreen as soon as possible. You start using antioxidants, not because you have a problem in your skin. It's just that you're preventing problems, But you can start retinol at any time, dear, and 46 is just nothing. So please, retinol, don't forget a sunscreen in the morning. A retinol always has to be substituted with a sunscreen in the morning because the fresh collagen and elastin that is produced, right, needs to be protected from ultraviolet light. So you need to use your sunscreen when you use retinol, but please go ahead. Tomorrow is Mother's Day. So please, give a wonderful product to your mother that contains retinol and with a sunscreen. You can do that.
Yeah, and we do have a Mother's Day sale going on Health and Glow as well. So I'm going to just mention this in passing, but yes, definitely please go check out. We have some amazing discounts on some great skincare, hair products, makeup products for your mom. So we hope you give her something nice tomorrow. I think it's also important for us to, spend time with our moms. Moms are so like neglected when it comes to like actually spending quality time with them. We actually did some content on our page which talks about maybe this Mother's Day, spend like 15 minutes, put on a sheet mask, just, talk to your mom, gossip with her. It's so important. I think mothers just yearn for that. That's gold for them.
Absolutely. And what I feel, which will really help is, take a small kit of skincare products and actually apply it on them. And many a times,
Yeah.
like my mom, even if I gift her something, she just doesn't know how to use it. She's like, what do I do with this? And then she'll look at the price and she'll say, oh, it's too expensive. I can't buy it again. That's the way our moms think. So I feel, spending that little time telling her how to actually, cleanse and how to use the night serum and making it very simple for them. Like keep the night serum next to her bedside, on the bedside table, so that
Yeah.
when she doesn't forget, and each time she applies that, she remembers you. That's what she wants, that memory that is associated with something. So I think this is the right time to create that.
I think that's such a sweet thought, and I think like moms, if I had to think about like my mom and her generation, like she's over 60 now. And like you said, I think one thing is that they probably like never took care of their skin the way that we do today, or at least the kind of conversations we have about it today, because for them it was so like simple and like natural beauty.
Yeah.
So it's important to also teach them how to, you know, use these products, how to layer
That's,
them, and, you know, all of that.
yeah, I'm telling you, they love it. It's not the product that's important. It's like that you're sharing something with them, and every time they use that, I get a message from my mom or my dad that your mom is fretting over the serum that you sent, you know. So they just remember you with that. So that's all.
Okay, so we have another request to join the video. It's by Mannat. Mannat, I'm going to let you in. She has a question about makeup products that moms can use. Hey, hi,
Hi.
Mannat. How are
Hi,
you?
Manat.
Hi, Dr. Amee. Hi, Rashmil. How are you?
All good, all
uh,
good.
so I actually wanted to ask on behalf of my friend who is a new mom. She just had a baby last month, and I actually have been looking for things to gift her. And what I want to ask essentially is what are some good makeup products that new moms can use? Because it's important for them to take care of their skin, and also because, like you mentioned earlier in the session, that babies are in constant contact with the mother's skin, right?
Yeah.
So, what is something that's safe for the mom and the baby?
Yeah, no, that's a very important question, and I think your friend is very lucky. You know that you're thinking so much before gifting her. So that's really great. So you know, for her, what I want you to do, Manat, is pick up the best one of the organic aloe gels. Now, why I'm saying aloe gel is just 1 month into pregnancy. I mean, post pregnancy, they have a lot of inflammation, and that inflammation many times leads to dryness as well as acne. But aloe has this wonderful property of anti-inflammatory along with reducing dryness. So, ask her to apply, as I said, when she's brushing her teeth, the first thing, let her apply the aloe gel. This, even if the baby touches and it just goes in, that's fine. The second is pick up a tinted sunscreen for her. You know, a sunscreen that has only zinc and titanium dioxide. Now, tinted sunscreen works as a foundation and a BB cream. So the advantage is that she gets that glow and she gets even skin, and it's absolutely safe for the baby. So, you can pick up, there are wonderful tinted sunscreens available in the market. You can pick up, as I said, Revela tint. There is something called Suncross tint. And she just needs to immediately apply after the aloe gel. All set. She look as if she's, put on makeup. The other thing that she can use is a liner. And I really like these liners. I had said even earlier, these are the peel-off liners. So, they don't smudge because you don't sleep well, right? You tend to do this to your eye and the makeup generally smudges, but these are just peel off. So even if you do this, they will not smudge. And when you don't want it, you can just peel it off, just like Fevicol. So that's the next thing you can give. Avoid giving her lipsticks which has a color in it, but you can give her just lip balm, especially with an SPF. The color is a problem because we keep kissing our baby all the time, and we don't want it to go onto the skin of the infant. So just give a lip balm. I like the Sebamed lip balm, because it is absolutely safe. Or you can give something shea butter or mango butter containing lip balms. That's fine. These are the things that you can give. And for the body, I want you to, if she's the type who has time, get her some salt based body washes, rock salt based, because after pregnancy I really feel it gives them a lot of rejuvenation to the body, because the salt helps increase blood supply. So get those rock salt body washes or body care for them, and that should be great for her.
All right, thank
I
you.
just want to
That's
add one
very
thing here,
helpful.
Mannat. Actually, like I said earlier, like my sister is also a new mom, and recently we had this conversation where, she had to go for a wedding, and she was like, I don't know what to buy. I mean, her baby is 9 months old, but there are brands out there that do have, herbal makeup products, or they do have. Don't look at brands which are like, which just say clean beauty or which just say vegan and cruelty free, because that doesn't mean that they are safe and natural. that just means that they don't have animal-based products in them. So I think one thing is very clearly maybe also educating her and helping her understand what's good for her, what to look on those labels. And also there are brands that do herbal makeup as well. So maybe you can check out some of them and you can reach out to some of them and even check with them if these are like absolutely safe for moms. We picked up a couple of them as well. So my sister's in experimental phase, but I just thought I'll mention this.
Great. That does sound very helpful. Thank you so much.
Thanks, Manna. Hope this helps.
Bye.
Bye.
Okay, so I think time has flown. We're pretty much towards the end of our session. I just want to say thank you so much to everyone who tuned in. We had some really good questions, great interaction. Some of you actually came on call. It was really fun talking to everybody today. I just want to also, mention just one more point, Dr. Amee, again here, is that we've spoken about how skin changes and we've spoken about skin type in general, also changing. I mean, how do you think moms should deal with, the changes in their skin? Like, is there a need for them to keep changing their skincare routine? Is simple better here in this case because your skin is always changing? Just some closing remarks from you overall on how the session was and some more points. Yeah.
Yeah, so yeah, it was a wonderful interaction. I think today it was great to have people online, because then we could talk to them and could actually see them and, speak with them. So that was wonderful. Just one tip that I want to give all moms is that don't fret too much because, your hormones are going to change every couple of months. So you can't keep changing your skincare routine. So stick to the basics, get very basic, simple things. As I said, just the 3 things. If you're worried about your skin type, you can go to our Health and Glow app and check what skin type you have. We also have recommendations, which I have put in the basics also over there. So you could, use that as a guide and pick up the right product you want. Remember, 3 things are very important. Clean skin is an inside job. As I again repeat, eat well, sleep well, be happy. Second is don't forget your sunscreen. Very critical. And the last and the most important is when you apply your product, touch your skin, feel your skin, give yourself those 30 seconds and believe me, the product works much better. So, spend a little time away from your baby and do that for yourself and it'll go a long way in keeping you happy.
Just one question, and this is more for, maybe some of the older moms. What is the best format of using retinol? Like, how is it best used?
See, if you're looking at a younger mom, around 30s, mid 30s, a cream is a good format, because you don't want very concentrated retinol, which will lead to irritation and peeling of the skin, right? So this is the early moms who just post pregnancy in their mid 30s. When you cross your 45 and you're coming towards the menopausal stage, we suddenly cascade, suddenly those lines and wrinkles become very static and visible. That's the time you need to go into a more potent form. And that's when you use things which are serum based, because they are far more potent. Now, only retinol, as I said, is not always enough. You need to add things like a hyaluronic acid, antioxidants like vitamin C, vitamin E. You need to add lightening creams like kojic acid, arbutin. So depending on your skin, you do the addition of retinol. So you can add a retinol with hyaluronic acid, if you have a lot of lines and wrinkles and the skin is dry. If you have pigmentation and uneven skin tone, you can add it with niacinamide and vitamin C. So, retinol, you just have to pick up a good combination so that you can apply it and it gives you best of both. But a cream or lotion form when you're younger and a serum form when you're older.
Amazing. Okay, so I think we've managed to share a lot in this short session. I think we've We've covered from pre-pregnancy to during and post-pregnancy. I think for some of you who are joining on behalf of your moms, moms that are, over 40 or over 50, it's so important. Please spend time with them this Mother's Day. Show them how to do skincare. They don't know probably, and, they're not comfortable with it. So I think it's just so important to, spread the word on this and really, help all the moms out there, whether you're young, whether you're older, to be able to feel good about themselves, to be able to give time to themselves, and to be able to feel good about their skin. I just want to say again that, like Dr. Amee said, if you are confused about your skin type, or if you also want to familiarize your mom with her skin type, do go ahead, check out Skin Expert. Dr. Amee has curated all the recommended products, so you can be sure that they're safe. There are basic options in there. Please do take, some of the tips that she shared during the session to pick the right products for you based on, what stage of pregnancy you're at, or if it's post-pregnancy or for your mom. There's a lot of tips here that could help you pick the right products and build the right regime. It can be simple. It does not have to be complicated. For everyone who's just waiting around, we will announce a winner for a little surprise, based on the great interactions that we had in today's session, actually. So please do keep following Health and Glow. Tune into our page. Monday we will announce who that is, and we will let you know what you've received as that little surprise as well. The next session is going to be about a topic that all of us, always wonder about. It's really something that none of us really know exactly, and Dr. Amee is going to help us demystify it. We're going to be talking about serum. Serum is some sort of a buzz product right now. Everyone wants a serum. Everyone knows they should have, and we know that they're potent formulations. But really, how to pick the right serum for you, and how to read those labels, those product labels, how to know what is going inside your product and what you're actually putting on your skin. Since this is a very vast topic, we will start with just serums first, and then we will go ahead with discussing other products as well. If you guys have any recommendations for topics, you can write to Think Skin Clinic, you can write to Dr. Amee, you can write to us, to Health and Glow, and we will definitely would love to cover topics that you all really want to hear more about. Dr. Amee, any closing remarks from you?
No, just to tell everyone that since we're going to talk about serums, I'm sure you have a lot of questions. And, when we go live, many a times you don't get the time or you forget. So please, from now, start writing your questions and start posting it and sending them to us. So it gives us a better direction and we can spend more time in explaining those things, So please write from today, whatever question comes to your mind, even if it's a product, you can send a picture of the product and we can guide you basis your skin type. So please do send us right from now.
Absolutely. And we're looking forward to hearing more from you all. Thank you so much for joining in. Happy Mother's Day. Happy Mother's Day, Dr. Amee. Happy Mother's Day to all the moms out there. We hope you have a great Sunday and a great time. And I hope this session really helped all of you. Thank you all and have a good weekend.
You too. Bye, Rashmal. Thank you. Thank you, guys. And
bye.
with lots of questions. Bye.
Bye.